Good morning, everyone. I'm Adrian Dix. I'm BC's Minister of Health, and I want to acknowledge with the histories, the customs, the culture of the Musqueam, of the Squamish, of the Tsleil-Waututh people on whose lands we're holding this event, on whose lands we meet today. We are, of course, grateful to be here. Joining me today are Premier David Eby, Chris Chu, the President of the British Columbia Pharmacy Association, Robin Rivers, a patient who used the new system on June the 1st for eczema, and Penny LaHoo, the pharmacist right here at London Drugs. Now, it's the great London Drugs, almost as good as the one at Kingsway in Wessex, almost as good, just want to say that, which Geraldine Vance and I use, but it's wonderful to be here today. About a month ago, as you know, we announced the expansion of pharmacist scope of practice. And today we're very glad to provide an update on how that's going and announce further access to make the new pharmacist assessment and prescription service even more accessible. And here to share the news is Premier David Eby.
Oh, smattering of applause. Thank you. Yeah, that was nice. Yeah, nice. Thanks for the welcome. We don't have enough applause at press events. I don't know why that is. I'll speak to the press gallery president about that. I'll join Minister Dix in recognizing we're on the territory of the Coast Salish people, and really glad to be joined by our guests here today for this important announcement. We are here today at London Drugs Pharmacy right in the heart of downtown Vancouver. And just to give some context for today's announcement, I think everybody knows the feeling. You know, you're in your minivan, you're driving the kids to birthday parties and to the swimming pool. And between that and the last episode of Secession, you realize your prescription has run out. It's like, no problem, pharmacy's on the way home. But you know how this story ends, you're out of refills. And that was a problem until last month in British Columbia. And we're recognizing the realities faced by families trying to access healthcare, seniors trying to access healthcare, and the challenge that our healthcare system and healthcare systems across Canada have faced post-pandemic. It can be a hassle to get a prescription from a doctor for something routine, something like contraception, or something minor like allergies. We're all better off when we can ease the pressure on our healthcare system as a whole. It takes pressure off our emergency rooms and limited resources in the healthcare system while still delivering quick access to people for the care that they need. Our government is working and moving forward on key reforms for the long-term health of our system. We're building new hospitals across the province. We're building new clinics to make sure, urgent primary care clinics, to make sure people get services that they need in their communities. But we also need to take steps today to recognize that people need care today. And that's partially why we're here today, because pharmacists have a key role to play in making sure that that happens. They're familiar faces in the community, they're trusted medical experts, and they're really easily accessible to most British Columbians that need help, right behind the counter at the local pharmacy. For these reasons and so many others, we gave pharmacists the ability to issue prescriptions. And we're 1 month in to this work that we've done in partnership with pharmacies and pharmacists, and the early results are in. In the first month, we saw 25,000 plus people in just 1 month see a pharmacist for treatment of a minor ailment. That's tens of thousands of people who were able to access care quickly when they needed it, freeing up doctors and hospitals for those with more complex care needs. And now today we're taking another step forward in partnership. Starting tomorrow, people will be able to book an appointment online to see a pharmacist. The website goes live tomorrow morning at gov.bc.ca/see-a-pharmacist, and British Columbians will be able to book an appointment with a pharmacist. This makes British Columbia the first province in Canada to offer a province-wide online booking tool. And Minister Dix is going to share some of the details about how that's going to work. For now, I'd like to thank Penny and Chris for your incredible work serving British Columbians. It wouldn't be possible without the remarkable pharmacists we have in our province. By stepping into this expanded role, you're providing such a service to British Columbians and to our healthcare system. I'm also so grateful to Robin for being here to share a story about a personal journey through our healthcare system and the difference that this has already made. Not in weeks, not in months, not in years from now, but right now, a difference is being made for British Columbians, and starting tomorrow, the online booking, June 29th. This is about getting the healthcare that you need in your community when you need it. It's about taking pressure off our entire healthcare system. I can't wait to see how this new system works out and rolls out in communities across the province while we continue to work to strengthen the healthcare system for the long term. New hospitals in Dawson Creek, in Surrey, in Richmond, here in Vancouver, the first new medical school in 50 years in Western Canada, opening with SFU in Surrey. Faster assessments for internationally trained nurses and doctors. Over 3,700 internationally trained nurses are in the queue committing to work in British Columbia, getting assessed right now to be deployed into our healthcare system. And we're helping more people get a family doctor. We have now 583 family doctors that are participating, taking in new patients who weren't previously taking long-term patients in our healthcare system under the new deal we entered into with the Doctors of BC. These are all important steps with more to come in the weeks and months ahead, but right now I'm excited for tomorrow and the difference this is going to make in the lives of so many British Columbians as we become the first in the country where you are able to book an appointment directly with a pharmacist online, all with a few clicks of a button. Thanks to everybody here for helping get the word out and for helping make this possible.
I think you're going to the left. Thank you very much, Premier. The new booking system is going to make a big difference for people, as it did, as you know, the booking system during the COVID-19 pandemic, which so involved community pharmacy. It's very similar to that system, the Get Vaccinated system, where people booked appointments to get their COVID-19 and influenza vaccinations. Through the system, people will be able to search for available appointment times at nearby pharmacies based on their minor ailment or contraceptive needs and book a time and location of their choice. Should they choose to do so, people can also continue to access the service by 1, calling, 2, visiting a pharmacy to book an appointment, or by a walk-in without an appointment, understanding that they may not be always available for a pharmacist to see you. By making it easier for people to make an appointment, we're helping more people get the care they need faster and reducing pressures across the healthcare system. Since pharmacists have begun providing the minor ailments and contraceptive service less than a month ago, from June 1st to June 27th, more than 25,000 people have received help, which demonstrate the need for this change, the value of pharmacists' work to the public, and the continuing dedication of pharmacists to their patients' care. To speak more about these benefits, and we did this about a month ago when we launched the program, and the new changes, it's a pleasure to invite Chris Chu, the president of the BC Pharmacy Association. Chris.
Thank you, Mr. Dix. Thank you, Premier Eby, for coming out today. My name is Chris Chu. I'm the president of the BC Pharmacy Association, which represents community pharmacies and pharmacists across the province. I'm also a pharmacist myself. As pharmacists, we're incredibly proud of the work we're doing to help British Columbians get treatment for minor ailments and prescriptions for contraception. We thank the government for their leadership in helping British Columbians patients get easier access and care through our pharmacists. There are more than 1,400 pharmacies across BC that are in communities large and small. We're open after hours and on weekends so patients can come in to see us when and where they need the help. In fact, on June 1st, the first day we were able to offer the service, we had a pharmacy have 10 patients come in after 7 p.m. for access for their minor ailments when other clinics were closed or full. We've also heard of patients waiting outside of the pharmacy before the pharmacy even opened on the first day. This really shows that there's a demand out there, and the government deserves acknowledgement for meeting the needs of their patients. We know that our patients have trust and confidence in us, and numbers released truly show that it is there. British Columbians for years have come to us when they need help dealing with headaches, acne, or rashes, and we've been there for them, and we will continue to be there for them. With BC's new provincial booking system launching tomorrow, it will be easier for patients to find a pharmacy and a time for a pharmacist to access them for their cold sore, a rash, an allergy, or even a simple urinary tract infection rather than going to an emergency department after hours. And they can always walk in to speak with our pharmacist about a minor ailment or a prescription for contraception. BC pharmacists are here, and we're always ready to help British Columbians when they need it. Thank you.
Thank you. Thank you very much, Chris. I'm greatly appreciative of your ongoing work and collaboration as we work to launch this service and all the work we've done, really, especially before the COVID-19 pandemic, but especially since the COVID-19 pandemic at every level. The work done by community pharmacy in BC has been exceptional, and the work we've done together has, I think, been transformative both for the healthcare system and for many people in communities. I want to, of course, this is fundamentally about meeting patient needs, and it's a real honor for me because I think when patients tell their stories and when people get the care they need and can tell their stories, it really has important value for people. I want to introduce Robin Rivers, who used the service on the first day, June 1st, and to describe her experiences. Robin?
Well, Chris, I was the person standing in line waiting for the pharmacy to open on June 1st. I had a rash. It had been on my eye for about 3 months, and we haven't had a family doctor since our family doctor retired in 2019, just short of the pandemic, and we hadn't been able to find another doctor who was taking a family of 4, and so we haven't had a doctor for almost 3 years. I don't go to the clinic because the clinic is always full. I don't go to the emergency room because I don't want to wait 9 hours for a rash. And so for me, when I saw the announcement on Facebook, I was like, what? I can get a cream for my rash? And I was there standing in line, and our pharmacist has been our pharmacist for like 10 years. And so we knew them, and it was good. I could go in and I could say, hey, I have a rash. And they're like, hey, you're our first customer. and so I got the rash, and of course it was gone in a couple of days, and they phoned afterward to make sure that I was okay. I went back in, they checked everything out to make sure I was okay. It was pretty much like a GP experience. And so my family has used it since then, and we've been so grateful. I can't tell you how grateful we are for it because we have been without a family doctor for so long, and it just makes these simple things that we wouldn't treat until they got really bad easy to deal with. And so, and we would have never done it unless it had gotten so bad we had to go to the emergency room. So I'm very grateful to both the province and to the BC Pharmacy Association for giving us access that we would have never had before. So thank you.
Thanks, Robin.
Thank you. Thank you, Robin. Helping patients like you, Robin, get the care they need is why we're here today, and getting that care easier and faster by trained professionals who are prepared and able and qualified to do this work, and such as pharmacists is an important thing. And so I want to hear from another pharmacist. We already heard from Chris in his as president of the association. I want to hear from Penny LaHoo. She's a pharmacist at London Drugs to speak about her experience in providing the new service. Over to you, Penny.
All right, so good morning. As pharmacists, we're the most accessible healthcare professionals and medication experts. Pharmacists are well positioned to prescribe for minor ailments. We've always been able to offer non-drug service advice to people with select a safe and effective over-the-counter medication. And now it's great that we can decide to add a prescription product when appropriate without referring them on to the doctor right away. As we know, pharmacists in BC can now prescribe for 21 minor ailments and contraception. A few of the most common requests for prescriptions that we see right now include urinary tract infections, seasonal allergies, conjunctivitis like red eyes, cold sores, skin rashes. We're also seeing a lot of demand for contraception right now, especially since many types of birth control are now free for BC residents. Patients are very grateful that we're offering this service. As an example, I was recently helping a patient with an assessment for seasonal allergies. She was really congested and sneezing and suffering from all the cottonwood blowing in our area. While she has a family physician, her doctor is really busy and she often has to wait a few weeks just to get an appointment. I was able to do the assessment for her and can provide her with a prescription for a nasal spray and an over-the-counter antihistamine, and I offered some other advice to help her manage her symptoms. She was really happy to get everything that she needed right at the pharmacy. and that I would inform her doctor of the plan when we were done. Plus, I felt really great about being able to help her right at the pharmacy as well. The new booking system will mean patients will have more access to care. Until now, patients have had to phone the pharmacy or drop in to make an appointment. Now, with the provincial online booking system, it'll be easier for patients to find the services that they need and to make an appointment for a time and a location that's convenient for them. Different pharmacies might offer walk-ins, scheduled appointments, or a combination of the two. From the pharmacy's perspective, though, the booking system also helps us to manage our workflow so that we can open appointments for the times of day that work for our team. This might be early in the day, late in the day, or in the middle of the day when we have more staff. It's completely flexible for us. We can also offer drop-ins and can plan our day around our other types of appointments and duties like vaccinations or medication reviews. The booking system is also a way for us to connect with new patients who've not been to our pharmacy before, just like we saw with COVID and flu vaccinations in the fall. So we're really looking forward to using the new system to help us manage these appointments. So thank you so much to the BC Pharmacy Association for their continued support and guidance. But more importantly, thank you to Premier Eby and Minister Dix for approving the BC Pharmacist expanded scope of practice and for providing this new booking tool for our patients. Thank you.
Thank you very much, Penny, and thank you for all the work and your perspective. I think we have, as the Premier mentioned, a new Health Human Resources plan that we put in place last September with 70 actions to address the health human resources needs of the province now and in the future. And that means, of course, actions to retain more healthcare workers, action to train more healthcare workers, and you see that the new medical school, the 128 spaces, new spaces at the University of British Columbia for doctors, for all of the new spaces for nurses and health sciences professionals, the impact of the HCAP program on healthcare workers, which has led to thousands of new healthcare workers, particularly in long-term care and home support. We obviously need to find better ways to attract internationally educated doctors, and you've seen the impact of the major changes we've made, including our work with the federal government, which had its own announcement on this issue today. And the other thing we need to do is adapt and redesign our healthcare system to allow the extraordinarily trained people, such as pharmacists, to work to the full extent of their scope of practice. Over the last number of years, the BC Pharmacy Association, I want to acknowledge the work of both Chris and of Geraldine and everyone at the Pharmacy Association, have done an exceptional amount of work in this area. We started with immunization and vaccination. When I became Minister of Health, about a third of vaccinations occurred in community pharmacy. Now it is the vast majority of vaccination, and we had a record year for influenza vaccination, which made a very significant difference for everyone during respiratory illness season. Pharmacists stepped up during the COVID-19 pandemic and offered in more than 1,000 locations across BC access to vaccination that was critically important for people across BC. Last fall, we changed a number of scope of practice issues around adaptation for patients. 30,000 more adaptations every month, which saves the time of family doctors and provides people the care that they need. And now, starting June 1st, for the 21 minor ailments, and this announcement today, which allows people to easily book online, the role of community pharmacy across British Columbia is growing, and is growing in a way that's consistent with training and scope of practice of this extraordinary profession. And I, for one, am grateful to them for all the work that they've done. This announcement today, we're going live tomorrow morning at 7 a.m. 600 pharmacies right now are taking part, and that number will grow. And so starting tomorrow morning at 7 a.m., you'll be able to go on, just as we all have during the COVID-19 pandemic, to book appointments at community pharmacy, as I have, and everyone else has during this period. We'll be able to go on and book appointments and be able to book appointments for 21 minor ailments. And so that is important. And for contraception, that is important, I think, for people across BC and an expansion of service. It is using the outstanding trained professionals we have to the full extent of their scope of practice. And I'm very thankful to pharmacists and to everyone who's been worked so hard on this initiative. And with that, I'm going to hand it over to Jimmy Smith and back to the Premier to take media questions.
Thanks for joining us today. We have members of the media here in person and members of the media online. For those online, please press *1 to enter the queue. You can unmute your phones. You will not be audible until the moderator unmutes you. We're going to start here on the ground. All members of the media will be limited to one question and one follow-up. We're going to start here on the ground with Aaron MacArthur from Global News. Aaron, go ahead.
It seems a strange system that we can now book online appointments for pharmacists, but not the first available doctors. Is there any thought to expanding this online system so people can have access to primary care?
Thanks. That's a great question. The announcement today is about making sure that people have access to care in their communities where they are. Not everybody has access to a family doctor. So making sure that if there's a space at your pharmacy, there's a pharmacist available to see you, that your ailment falls within the categories that they're able to assist with, that you're able to be assured that when you show up, there's going to be someone there for you. As you heard from Penny, some pharmacists will be doing walk-ins. Some will be relying on the booking system, but we're really excited to see this roll out. As for doctors, I'll turn it over to Minister Dix about our work on that.
I think the Premier said it well earlier, the key with family doctors, and you've seen already some improvements over the past year. There's, according to the source of information, the Canadian Institute for Health Information, the Canadian Community Health Survey, where about 100,000 fewer British Columbians need a family doctor now than did in 2021, so that's improvement. We've changed, of course, our system for attaching people to a family doctor, and we're going to have some things to discuss in the next couple of weeks, Aaron, about the ability to find attachment to a family doctor, which is the key issue for people in BC. Our new model, Premier said 583, it's 590 now. It's yesterday's news, 590 today. Doctors who did not practice last year, who are now practicing, and that is significant in the building of the system. We're also seeing, especially in rural, remote areas, significant advances in booking out virtual care, both for doctors and specialists, which are important to do. So this is a sea change. More than 3,300 doctors who have essentially left the fee-for-service system and are joining the new payment model, which will mean better care for patients, also better balance in life for family doctors. And what we're seeing is a transformation. We also have new-to-practice contracts for new family doctors. We went from 20 to 30 to about 135 last year under the new-to-practice contracts. So yes, we're going to have more to say about the issue of attachment, not about appointments, but about attachment in the coming weeks.
Aaron, do you have a follow-up question?
The Premier, I'd like to get your reaction on Port Coquitlam's banning of public consumption of narcotics, and a question whether the province might consider stepping in to pass laws to supersede municipal authority here.
Thanks for the question. I've seen that Mayor West in Port Coquitlam is addressing the issue and the concern that he has, that people in Port Coquitlam have about public drug use through municipal bylaw changes. I think for British Columbians generally, and certainly for our government, we understand the toxic drug crisis, the challenges that people face with addiction and mental health in our communities. And we also understand the parks, schools, playgrounds, community spaces need to be safe and welcoming for everybody. This is a challenging balance, and it's important to know that municipalities have the tools, if they're seeing issues in their communities, to be able to take action to ensure that those community spaces are welcoming for everybody. We've heard this issue raised not just by Mayor West, but by other mayors and community members. We're currently working with the Union of BC Municipalities through the Ministry of Public Safety to see what tools we can bring to the table to support municipalities to address these issues. They do have a suite of laws that they can pass right now, as Port Coquitlam has demonstrated, but some municipalities don't have the resources, the capacity to be able to do that kind of work. And so one of the areas we're looking at is a potential new law, new legislation in the fall session to support municipalities to make sure that we're sending the message that these community spaces need to be available for everybody, but also recognize the challenging balance and the public health crisis we're in related to addiction, mental health, and the toxic drug supply. It's challenging but important work, and I'm glad the Public Safety Minister is working with municipalities to take this on.
Our next questions, we're going to stay on the floor, will be from Audrey Simon, Radio Canada. Go ahead, Audrey.
Hi, Hi. So there's a press conference outside your office to mark the second anniversary of the deadly heat dome. So can I ask what has been done since the heat dome, to prevent and limit impacts of climate change?
Yeah, thanks for the question. British Columbians are on the front lines of climate change. We have seen smoky summers, out of control forest fires, the atmospheric river, epic floods in the valley, washing out highways through the mountains, pine beetle overwintering, killing a huge number of our trees and really badly hurting our forest industry as well as communities around the province. In many ways, it feels like British Columbia is seeing these impacts first. But I can tell you, after meeting with the Western premiers in Whistler over the last couple of days, they are seeing these impacts in their communities now too. And one of the commitments we made was to support each other and to work together on two fronts. One is emergency response. If we see heat domes or forest fires or floods, to continue to work together to support each other in emergency response. And the second is around climate change, taking action to fight climate change, to reduce our emissions together. How can British Columbia, for example, one of the topics, how can we share our abundant clean electricity with the Yukon, with Alberta, to help the Yukon get off diesel in remote and rural communities, and help Alberta reduce their natural gas use to produce electricity and drive down their emissions in their province. This is important work that we all need to do together. On the specific issue of the heat dome, which is one of many climate-related emergencies we've seen in British Columbia, the province has taken action. We've improved and expanded cooling systems in long-term care homes across the province. BC Housing has expanded cooling systems throughout public housing. We've worked with school boards to expand cooling systems in public schools and new schools to ensure that they have cooling systems built in. We've worked with local governments and First Nations to fund cooling centers to ensure that people have a place to go in community in the event of a heat-related emergency. We have a new 911 dispatch system that provides heat warnings proactively to British Columbians through text messages on their phones. Minister Dix just yesterday made an announcement. 8,000 people in the province, families, individuals, will have access to free air conditioners through BC Hydro, through a new program that the province has introduced, $10 million to support that. We're going to continue to do this work because we continue to expect to see the impacts of climate-related disasters going forward.
Audrey, do you have a follow-up question?
Thank you. Speaking about the air conditioners, when we are speaking on vulnerable groups, it seems access is still limited. For populations who have difficulty going online or accessing an app, how can they access these services, especially for seniors or minority individuals whose first language isn't English?
Thanks. That's a great question. There are a number of individuals who we anticipated might not be able to proactively, first of all, know about the program or be able to access it. And groups that we're particularly concerned about related to high levels of heat are people with medical conditions that make them more vulnerable to extreme temperatures in terms of being able to survive those temperatures. So we've also partnered with healthcare professionals to be able to refer people to this program proactively. So the individual themselves doesn't have to know about it, but their healthcare professional can assist them in accessing this program and getting the cooling system that they need for their apartment. We're going to continue to do this work and make sure that communities that need that support get it.
Our next question is coming from the floor is from Penny Daflos, CTV News. Go ahead, Penny.
Hi, just a question for the minister first. Yesterday you'd mentioned that we'd be able to, there was a report coming out on response to the heat dome and the coroner's recommendations. Is that coming soon, and what can we expect to see in it? If you could just comment on that coming report.
Yes, and it'll be out shortly. I expect it to be posted, and really it's just a review on the issue of air conditioners, first of all, on what they've seen in other jurisdictions. So we did a review of what other jurisdictions have done. Our program, for example, is larger than in Oregon, but what they did in Oregon tells us that the sizing of the program, the $10 million is what we needed right now. So you'll see that in the review, and it'll also be a review of the actions that the Premier's just described that we've taken. So in the BC Coroner's recommendation, they asked us to work with the Ministry of Social Development specifically on the issue of air conditioners, and so you'll see the review of the information that supports the decision we took yesterday.
You'll follow Penny.
I do. This one's for the Premier. When it comes to the heat dome response, I mean, we know that it was disastrous and insufficient at the time, but even last year we still had 16 British Columbians dying from hyperthermia, and this was after we had the HARS system and we made all sorts of improvements. So I'm just wondering if you feel that the changes that we've already made are sufficient, and what more you'd like to be able to see to respond to heat events that are literally life-threatening.
Thanks, Penny. Well, certainly British Columbians are seeing that we have increased frequency of climate-related disaster, including climate-related disaster that puts people's lives at risk. We had 2 people die in the catastrophic fire in Lytton, where an entire town burned down shortly after setting a North America heat record. We have massive and out-of-control wildfires right now in our province. A wildfire in the northeast that's expected to burn right through the summer. And as these climate disasters get needs to certainly keep pace. That's why we've established a separate ministry dedicated to emergency management and climate resilience that is coordinating our effort as a province to be proactive, to look at where can we find the equivalent of the Abbotsford pump, for example, those weak links in our system that might put communities at risk, and ensure that we're approaching this in a strategic way. The estimates of the expenditure for the province, for the country around climate adaptation, the cost is massive, the scale is massive of what we have to do. You saw the federal government come out recently with their own national adaptation plan. And so we need to be strategic about where we put that investment to address those high priority areas. And for heat dome, for example, ensuring we're continuing to build on our work of expanding cooling solutions everywhere from schools to individual homes to long-term care facilities and so on. So the work is certainly not done. We have a lot more work to do. But I want to reassure British Columbians that we're approaching it in a very systematic way, working through from the highest risk areas that require our first priority, and that is a key mandate and a reason for the establishment of the new ministry that takes on emergency response and climate resilience.
For our next question, we're going to go to the phones with Rob Shaw from Check News. Go ahead, Rob.
Oh, hi, Premier. Just wanted to ask about the new $500 million rental protection fund launched today. Can you tell us if this final version with its structures is up to the task of doing what you said it was going to do, which is preserve rental buildings from being bought by private developers and will keep rents down? Is it enough money, and is the structure the right one?
Thanks, Rob. So this is a really exciting initiative, one that I'm so glad to see announced up and running, that they've established their processes. For British Columbians who are renting, I think, one of the most anxious moments you can have is seeing that for sale sign go up on your front lawn. What's the new owner's plan going to be? Am I still going to have a home? Especially older, low-rise buildings that were built in the 70s under federal government programs that no longer exist. They tend to have people in them who have lived there for 20 or 30 years and who are very vulnerable if they lose that housing. And so this initiative with $500 million of provincial government money is supporting the ability to go out and buy those older buildings, to make sure that the tenants in them are protected, that if there's an opportunity for redevelopment to build a new building on the site, that those tenants will be protected through that process by a not-for-profit housing provider that owns the site and is redeveloping it, so that we can make sure that we're not seeing increases in homelessness as a result of loss of this vital rental housing. One of the reasons why I'm so excited about this is that $500 million is very likely to be leveraged significantly by this new organization to be able to have more than $500 million worth of impact because they are working with a nonprofit sector that already has other land that they can use and resources they can bring to the table when they have that asset of the site of the rental building. So this could have impact well beyond government's money, and certainly that is what I understand the plan to be. And so that's one of the reasons why I'm so excited about the impact this is going to have to address a very real issue that is driving some of the homelessness that we see in our communities right now.
And Rob, do you have a follow-up question?
Sure. Can I switch topics to BC Ferries? It's looking like another chaotic long weekend. The corporation today says if you don't have a reservation, you should consider walking on because there's a ship stuck in repair, and they shuffled 6,000 reservations around, and it looks like chaos on another busiest weekend of the year. So are you worried that things aren't getting any better at BC Ferries now that you've switched leadership and pumped $500 million into this thing, and we still have massive lineups and frustrated passengers every time there's a significant weekend roll around?
Well, you know, I think for a lot of British Columbians, my own family included, we've got grandma's over on Vancouver Island, and so we will make the pilgrimage on BC Ferries. Long weekends are important for families to be able to get across, to visit relatives, to see people. But of course, day to day, our ferry system is so important for the economy of Vancouver Island, around keeping costs down and supporting families. So first of all, obviously, stable ferry fares are critically important. BC Ferries, like every British Columbian, is seeing pressure on costs. They're seeing the impacts of global inflation, and they were looking at a 30% ferry fare hike. We took steps to make sure that ferry fares would stay affordable by providing almost $500 million in resources to the Ferry Corporation. That was to make sure that fares are affordable for people who need ferries. And a critical step that, unfortunately, I say, the opposition decided to vote against. But we believe very strongly that the ferry system is part of our highway system for British Columbians, and that that system needs to be supported. The second piece of ensuring that our ferry system provides the service that people deserve, that there's space for you on the ferry to get to where you need to go, that they have the boats that they need. They've faced some significant challenges in finding the staff that they need. Our economy is very hot right now. It's difficult to find employees, and BC Ferries has been challenged by that. They have the same supply chain issues that many businesses are facing in getting parts and getting access to repair ferries, and we're seeing some of those impacts. We're going to see some of those impacts this weekend on the long weekend when families need it most. I don't find it acceptable, but I do understand the challenges that BC Ferries faces. For the long term, BC Ferries has the capital plan in place to get those new boats in place to ensure that people can get where they need to get, and I want to thank British Columbians for their patience this weekend, and I want to encourage BC Ferries to redouble their efforts to ensure timely, affordable access for British Columbians. I know that's what we all want.
Our next question will come from Wolf Deppner from Black Press. Go ahead, Wolf.
Yes, thank you. And I'll continue on the maritime theme here. The longshore workers issued a 72-hour strike notice earlier this morning. What is your reaction to that development in that labor dispute involving Canada's busiest port?
Well, thanks, Wolf. I'm profoundly worried about the potential impact of a strike at our ports, and this is for a number of reasons. British Columbians have already seen rising costs on a whole array of different fronts, on food, on essentials, driven by global inflation. Part of this is supply chain disruptions that we've seen, which included challenges at our port and our rail system throughout the pandemic period, and rising costs of shipping goods. To see the potential for a strike to cause even further costs for British Columbians is very concerning to me at a time when British Columbians cannot afford that. I really encourage the longshore workers. I know they work hard for our communities to provide food, resources, support that we need for exports and imports. I'm very grateful for that. Encourage them, as well as the Port Authority, to sit down at the table to work out a deal. Encourage the federal government to be there to support both sides in reaching a deal in this important area of federal responsibility, because British Columbians deserve a port system that's working efficiently to help provide and to press down some of the cost increases that they're seeing right now.
You have a follow-up question.
No, thank you.
Great. Next, we're going to go to Michael Williams from City News. Go ahead, Michael.
This is for Premier David Eby, and sorry if I missed this in the release or during the announcement yesterday, just regarding these AC units that are going to be dished out. The figures, a little bit confusing. $10 million for 8,000 units over 3 years, sorry. If they're all portable units, I'm just a little confused. I did the math. That's $1,250 per unit. Just a little confused on the numbers there on why it's so expensive.
Okay, thanks. I'm going to pass this over to the Minister of Health. Sorry.
What we're doing, Russell, is putting in place a new program for people in our province. And all of these units will require, or at least in many cases, will require installation by a trained professional. BC Hydro works on these projects all the time. They have a system in place to in their other low-income programs to identify qualified people when they apply. In addition, they'll be working with health authorities, and especially in community and home health, to identify people who need this support, who need a free air conditioner. So I think the program itself will work very well, and what we wanted to make sure is that it had the resources to meet the goals that we have. In addition, BC Hydro has a program with BC Housing, is working with Praxis and other groups to also provide air conditioners to other qualified individuals. And so yes, when you have air conditioners that often require installation to be safe, it does cost a little more, but the value of it for individuals and for their health can be incalculable, as we've seen over the last couple of years. So I think the resources have been put in place to make it work. And we believe that we'll have an effective program that will, with all the other things we're doing, provide close to 10,000 air conditioning units over the next 3 years to people who really need them.
And Michael, do you have a follow-up question?
Sorry, this is directed at Premier Eby. A question for my colleague here. Now, the shelter allowance is going up July 1st. Advocates have said this increase is only a drop in the bucket given the cost of living. And given this is the first increase in 16 years, why did it take so long for the NDP government to increase it, and why not increase it more?
Thanks. So we know a lot of people out there are struggling to pay rent right now, and that in part, this is driving some of the homelessness we're seeing in communities. We have a number of different initiatives to respond to this challenge. First of all, building a record number of social housing units across the province. People living on disability assistance frequently live in BC housing units. We have 17,000 of those units in development under construction right now across the province, making BC Housing one of the largest, if not the largest, housing developer in North America. We have an additional grant program for individuals that tops up money for them for shelter to respond to someone who may face homelessness because their allowance is not enough to allow them to get into market housing, but they can do well in market housing. So that grant was expanded in this budget, available for individuals who need that extra boost in high demand areas to get into housing and avoid homelessness, delivered through nonprofit organizations that see these individuals and know that they would benefit from that. We have a program for seniors, low-income seniors, the SAFER program, which we've also expanded access to make sure that seniors have access to housing. But ultimately, what we need to do is dramatically increase the amount of rental housing that we're building. We've set records for purpose-built rental housing each year that we've been in government. We're going to continue that work and expand that work. And in the fall, we have new housing legislation in place to encourage those municipalities that have been struggling to approve that rental housing that we need to help them hit the targets together that we know we're going to have to meet to match our growing population. Just so you're aware, we added 250,000 people to our province in the last 2 years. That's a lot of housing units that are needed, and we need to really ramp up our efforts to take the pressure off the rental housing we do have.
And that's all the time we have. Thanks for joining us.
Thanks, everybody.